Stillbirth, a major concern in India and worldwide. To be forewarned and forearmed, that is, to be prepared, is half the victory. So, what is stillbirth? A baby born with no signs of life at or after 28 weeks of pregnancy is called stillbirth, and this is the definition by WHO. So, why is it important to know about stillbirth? Because it affects 7,000 families every day worldwide. It has a major emotional, social, and financial implications on the family. 98% of stillbirths happen in low to middle income countries, and India has highest number of stillbirths in the world. So this is the data from 2015, and it clearly shows that India leads the world in the incidence of stillbirth. So what are the causes of stillbirth? Amongst important causes, preeclampsia is the predominant cause of stillbirth and prematurity. And what is preeclampsia? This is a condition where mother develops hypertension or high blood pressure after 20 weeks of pregnancy. It causes 1 in 5 maternal deaths, that is, a maternal death happening every 12 minutes somewhere in the world. So this condition is important because it could result in death or disease of the mother or the baby during pregnancy or after pregnancy. And what is important is that this condition can be predicted by ultrasounds and Dopplers done in the 3rd month and the 5th month. And we could start the tablet of aspirin to prevent this condition. So this is preventable provided we suspect the condition during ultrasound done at 3rd month and 5th month. And for the mothers who do develop preeclampsia, ultrasound and Dopplers are done in the 3rd month, in the 3rd trimester, that is after 28 weeks, to assess the time of delivery, because we do not want the mother to deliver before time. We do not want a premature baby, neither do we want a baby which lands up into stillbirth. So we do not want to wait that long either. Now, what is timeline for cardiovascular risk in the mothers who have had preeclampsia during pregnancy? 1 to 2 years after delivery, these mothers could develop hypertension or heart failure. 3 to 10 years after delivery, they could develop diabetes and dyslipidemia. And as many years as 10 years after delivery, they could develop heart disease or hemorrhage in the brain, which could result in stroke, that is, paralysis. So this could be as bad as death in the mother because of these reasons, heart disease or brain hemorrhage. These are short-term and long-term effects of preeclampsia. Who is at risk? Rural settings, women with no education, women not in paid employment, and extremes of maternal ages, that is, too young a woman or too old a mother, are at high risk for preeclampsia. Can it be prevented? A focus on stillbirth can save thousands of lives in India and worldwide. And what can a fetal specialist do? It's important to give awareness and education to the patient. We should be looking for the growth of the baby, the environment and structure of the baby on ultrasounds and Dopplers. And it's important to give a risk assessment for development of preeclampsia and to do a targeted scan for the baby, to do fetal Doppler studies and assess the mother for anemia, hypertension and comorbidities, which are diabetes, thyroid, or other maternal diseases. And what should a patient be asking the doctor? Patient should ask the doctor if the baby is growing normally, what is the fetal environment like, what is the structure of the baby like, and what is her customized risk for developing anomalies and risk for preeclampsia. We at Images Ultrasound Centre focus on customized risk assessment for preeclampsia and IUGR so that the mothers at risk could be started with aspirin. We do Dopplers for the growth of the baby, the environment of the baby, and the structure of the fetus, because saving each life makes a difference. Wish you a healthy and joyful motherhood. Thank you very much.